Hi, Dr. Minkoff here. We've been talking about anti-aging, and I want to now bring in another part of this, which has to do with prescription medication. You know, we have this attitude in America that it has to be now, and the result has to be right away, and that health is something that you can snap your fingers and get. You can take a pill, you can take a hormone, you can take a this, you can take a that. The basics of lifestyle are ignored, and I have a headache, so I'm going to take a drug. I have a pain in my shoulder, so I'm going to take a drug. I've got a little bit of nausea, so I'm going to take a drug. And there's a big downside to this, and the downside is that drugs are poisons, and these poisons are going to wreck your chances for aging long and aging well. So I want to talk about this a little bit because it's a huge problem, and it's mostly Americans that feel this way. If you go to Europe, their patience on health and what to do to achieve health is much, much different. I've had European patients who said, well, I say your testosterone's a little bit low, and they say, you know, I know here in America you give everybody hormones, but what is it that's holding my testosterone down, or it's not getting it up? And I said, well, there's this and this and this and this, and they say, well, how long will it take? I said, well, it might take 6 months to a year, and they say, well, that's fine, just like with complete acceptance to that idea, where the average American patient wouldn't feel that way at all. Now here's the point, and I think this is just an amazing thing. How many prescription drugs are you taking? Like, list them, okay? And I consider prescription drugs even over-the-counter drugs. If you're taking an antihistamine or an acid blocker or something like this, these are actually ex-prescription drugs, almost all of them. Only 1 in 13 people who are 65 or over don't take any regular prescription drugs. That means that 12 out of 13 people who are 65 or over are on a prescription drug, at least one. It's actually worse than that. 50% of people who are 65 take 5 or more prescription drugs. Okay? So you drive down the street and you have a 65-year-old driving a car, and they're under the influence of 5 or more prescription drugs. And you know, if you look in the physician's desk reference at diabetic meds, cholesterol meds, arthritis meds, these kinds of things that people are taking, and you look under mental, emotional, psychological effects, you will find that they all do that. They all do that. They're basically cell poisons, and they affect people. They affect their awareness, their perception, their reaction time. And we live here in Florida, so there's a lot of people over 65, and 50% of them are on 5 or more drugs. Now, this is amazing, because I used to be an emergency room physician. And many of the people who come to emergency rooms are people who are in nursing homes. And so you would get a 75-year-old from a nursing home coming in an ambulance who was semi-conscious. And the complaint written was, she just isn't herself, she's not quite with it, and she's complaining of a bellyache. And you get this person in the emergency room. And then you get their list of medicines. And the average person in that emergency room that I worked in, who was coming from a nursing home, wasn't on just greater than 5 prescription drugs. They were on an average of 12 prescription drugs. Okay? Because they needed something for sleep, and they needed something for pain, and they da-da-da-da-da-da. Okay? So we had a computer in the emergency room where you could plug in the drugs, and then the computer would give you what would be the interactions of those drugs and what were the potential side effects of those drugs. But you know, the computer, if you put in more than 3 drugs, it would go tilt. It couldn't tell what would happen with more than 3 drugs, let alone 12 drugs or 5 drugs. Who knows what this poor person's bellyache and lowered state of awareness was? My thing usually was, okay, we're going to admit them to the hospital, we're going to take them off their drugs, they're going to be monitored. If they actually had to have something for their blood pressure or something else, we're going to deconstipate them, because many drugs cause constipation. We're going to give them fluids, and many times a lot of them would just wake up. It was drug interactions that were causing them to be ill and have the problems that they were having. So if you want to live a long time, stay away from drugs. Doesn't mean that sometimes they're not necessary in an emergency, or you may have a problem that needs a temporary solution, which is a drug, but most of the time they're way, way overdone and they're not really even necessary. So there's these cascading side effects. One drug combats the side effects of another drug. So you take a drug and now you've got a little bit of nausea. So then you take another drug. And then the combination of those two drugs give you some arthralgias or some muscle pain. Well, then you're going to take another drug. And then you feel a little bit tired because now you're on 3 drugs and now you take something to like perk you up. Okay? It's just endless and it's crazy. So there's side effects and then drug interactions. So the real question is there something else that would work better and safer and more reliably with less risk to you? That's the real question. And in my mind, it isn't even a question. Bodies have problems because most of the time they're deficient in a nutrient or they're toxic with something in the environment. And if you look at it from this way, you can often solve the problem without resorting to a medication. Could the condition respond to a better diet, exercise, and better supplementation? And the answer is almost always yes. My first action with a new patient who usually comes to my office with complex symptoms of long duration and they're quite sick, most of them respond within 6 weeks to an organic paleo diet, lots of water, make sure that they have a bowel movement every day. I might use magnesium as a laxative or something natural. Okay, basic things. Get 20 minutes of sunshine every day and walk for 15 or 20 minutes every day. It's my basic prescription. And then a few supplements. I'm going to put them on a multivitamin. It's called Body Health Complete. I'm going to put them on fish oil. I'm going to put them on some magnesium. I'm going to put them on perfect amino acids, and I'm going to put them on a probiotic. And at 6 weeks, at a recheck visit, almost everybody's feeling better. Their intestine feels better, their constipation's better, their bloating's better, their energy's better, and their sleep's better. Usually it's a neglect of basic things that causes people to be sick. It might be excess of bad things. They're drinking too much. They're not sleeping enough, okay? They're not getting any exercise. They're just way too stressed out. These are all modifiable. And drugs don't actually do anything for those things except give you another side effect. So there's plenty of physicians around who do this stuff and who can help you. But my main point is, the next time you go to the doctor and you get a prescription written, I would think twice. Fix up your diet, make sure you're drinking plenty of fluids, get some sleep, handle your environment, make sure you're going to the bathroom, and voila, you'll feel better. Okay? Hope this helps.